Published on April 14, 2021, an article written by the New York Times details how the federal government failed to fulfill reporters from the New York Times requests for data on the COVID-19 outbreak. During the early months of the pandemic, data from some U.S. communities suggested that COVID-19 was affecting Black and Latino communities at higher rates than white people. However, when reporters attempted to make requests to acquire national data on the COVID-19 outbreak, the federal government did not allow them access to the requested data. This caused the reporters to file a FOIA request, or Freedom of Information Act request, to obtain the records. By filing FOIA requests, the reporters were able to get the much-needed data to be able to report accurately on the COVID-19 pandemic and how it is affecting our communities differently. The Freedom of Information Act and FOIA requests themselves are an essential part of media law, and a big part of this unit that we recently covered. Without the Freedom of Information Act, the government would be able to withhold any information they deemed fit, and it would be much more difficult for reporters to get essential information out to the public. By filing the FOIA requests, the reporters were able to attain the data from Centers for Disease Control and Prevention, the CDC, that confirmed that COVID-19 virus was infecting and killing Black and Latino populations at a much higher rate than in white populations. However, this was not the last time FOIA requests had to be filed to allow for proper tracking of COVID-19 cases, outbreaks, and deaths. Times journalists alone filed more than 400 FOIA requests and other similar open records requests to track COVID-19 outbreaks. However, requests can still be denied, and sometimes determination will not be reached for weeks, months, or even years. FOIA requests allow not only reporters to access accurate information, but the information received from these requests can assist in court case decisions and in other areas of media law. I thought the way that the reporters from the New York Times and other publications in the U.S. handled the situation was correct. When reporting on a subject that not only keeps the public informed, but is also important for public safety and health, such as the COVID-19 pandemic that is still ongoing, it is important to have the most accurate information possible. Personally, when faced with the same situation, I would have also filed a FOIA request, as I see no other option to get the data needed to accurately report what is going on in our country.